all the time. What about other toxins that are non-metallic? Pesticides, plastic residues. They're difficult to test for. They're a little bit tricky to identify. It turns out that sulfur and antioxidants and indirectly some minerals and enzymes, that's the way to deal with that. And cleaning up your environment at home and making sure you have clean food, water, and air and that kind of thing. Okay, genetic. Again, Dr. Underwood touched on this. Let me just tell you something, okay? And I'm not trying to force this down your throat or anything. Sickle cell anemia, that's genetic, okay? You have to have both parents have to have one of the genes. There's so many genes you have. If one of them you have and you're the mother and the other one your husband has and you're the father, and then you, by chance, half the time, let's say, give the one gene from one parent and the other, then that kid has two genes. And that kid is going to be a person that overtly has sickle cell anemia. And you can show on these things, Punnett squares and whatever you want to talk about, 25% of the time, that's exactly what you see, okay? And you can talk about balanced polymorphism, and you can show what the gene does, and one gene, one polypeptide, and all these central dogma that we all learned in biology, for those of us who are trained in that area, that's genetic, okay? Hemophilia, okay? Your mother has to have one X chromosome. I can show it to you on a piece of paper. You probably know this already if you're into this. That has the hemophilia gene. The other X doesn't. She's not sick. The dad can't have that if he's not sick. He only has one X to give that doesn't have it. Then there's the Y chromosome. What I'm trying to show you is that's clear-cut genetics. So he's never going to give hemophilia to his son. The mother is. Then the boys, you know, are going to show it because when he gives a Y chromosome, that's the boy, but the mom is the one who passed it along. The girls usually don't get it because the dad's not going to. I can show you that on paper. That's genetic, all right? I don't for a minute believe that in the classic sense like that autism is genetic. Is cancer genetic? And you know, heart attacks and strokes and cataracts, you can find trends in families. You can see that some of the body functions in people with those disorders is similar down family trees, okay? That's not classic gene inheritance, period. This nonsense that our enemies, and I'm going to come out and say this, our enemies are trying to ram this down everyone's throat to blow smoke because they can't stand this business of us talking, or me talking about vaccines and biomedical treatment and detoxification and all this other stuff is just absolute outright nonsense. It's not genetic. They're trying to confuse people who aren't geneticists, and it's just absolutely not true. So you can even find that bunions run in people's families, and you know, those things have some family trend, but you can't find a gene that shows that if mom has no bunions and dad has bunions, but some of the grandparents did, that they might have an autosomal recessive gene and all these clear-cut things that you can say, it just is not present in autism, all right? It just isn't, all right? And very much the case. They're trying to show that before you even fall in love and have a twinkle in your eye that it's genetic, for crying out loud. I just don't think that that's true. The genes can also be damaged by mercury, lead, cadmium, PCBs, that kind of thing. So sometimes we'll test genes and test things that look at what genes do. There's a lot of gene damage out there. Doesn't mean you inherited it that way, okay? Just doesn't. All right, the tests tell us that something's wrong with the gene now that they're autistic, or that they have RAD, or that they have OCD or Asperger's. Doesn't mean that's the way you gave it to your child. You know, they can't get off of this thing of blaming the mothers, you know, it's your fault, you know, or dad's fault or somebody's. Okay, what about metabolic abnormalities? What's metabolism? Okay. Well, suffice it to say there are many, many abnormalities in the metabolism of kids with autism and kids with PDD and so on and so forth, okay? B vitamins and mitochondria, Shannon Kenneth can talk about that when she gets up here, but mitochondria are the powerhouses inside your cells. They actually do some detox. They rearrange things and make some spectacular substances that no other pieces of living machinery can make. And when they don't work right, you can't do things that your body needs to do metabolically with metabolic tricks. These are bona fide medical problems, okay? Methylation abnormalities, I'm just a little bit more, I just have to simplify it myself. If you take a basketball and put it on top of a mountain and plug up a little bit of a spot where there was a little kind of cave opening like a volcano that was spurting out and happily just spewing a little bit of smoke, and you plug it up, that little basketball can cause big problems, and then the whole mountain can blow up. Or you can plug it up and maybe it'll do something different in another direction. That's kind of like methylation, okay? Methylation is you have everything in the 18-wheeler. You have a nice truck. You have, you know, cargo. You have a driver. You got fuel. You've got your road map, but you don't have the right front tire. You're not going anywhere. If you put on that right front tire, even though it's one of the smallest parts, profound changes happen inside of that big thing, and that's what methylation is. A little piece gets put on and it changes things quite a bit. And our kids don't do that properly, and they need help. This thing about folate and MTHFR, no, that does not refer to some of the legislatures in our country who have done the wrong thing intentionally under pressure from pharma, all right? Okay, that's methylene tetrahydrofolate reductase, okay? It used to refer to Senator Bill Frist, but he quit because he wants to go do something else, I guess. Transsulfuration, Lauren talked about very elegantly. There are many forms of sulfur, okay. What does this mean, though, in your child? Look at the bottom line I have there. How many of the kids have low tone? Okay, they can't use their, that's right. So go ahead, raise your hands. How many kids have, you know, they sit in the W position, and the therapist keeps telling them, okay, how many kids are toe walking because they have nerve conduction abnormalities, and the therapist says, feet down, please, those kinds of things. And those are good things for us to recognize and get help with SI treatments and occupational therapy and ABA and so on and so forth. But if there's a biologic basis, and what you saw on Dr. Underwood's slide with all those three kind of oval cycles driving each other, if that's not working good and those tissues need that to work properly and for the brain to send the signal, then sometimes we can help fix or ameliorate or improve that along with the therapist by aiming at where that comes from. And I always say, too, we talk about these blood tests that look at liver functions and kidney tests. When the cells have abnormalities in one part of your body, chances are there's going to be a good opportunity, sadly, for them to have problems in the brain. That's where cognition, speech, detoxification, that kind of thing, okay? Well, if I am here to tell you that I believe, and I think I probably have already shown in my shyness, that I believe that autism is a biologic illness, not a psychiatric disorder, then, of course, the treatment flows from that concept. So if you have a broken leg, okay, you're not going to go get a psychiatrist. Maybe later on down the road, if you were an athlete and you can't, you know, perform anymore, or you were a worker or a coach. I had one guy who was a coach, and he broke his one leg, and then he broke the other one, and then he couldn't get down on the mats with his kids. He gained weight, he got diabetic, and he was not able to do that part of his job. Then he needed to get counseling and all these other things. But he also needed some physical help. So, I mean, everything, I guess, all comes around. But you're gonna do something biological for a biological problem. So we doctors only do two things: diagnose and treat. What does diagnose mean? You do some testing. Now, sometimes the testing is look in your child's ear and see if there's an ear infection. Look at the face. If that's puffy, sometimes those are the atopic pleats. Atopic means allergic. Kind of like Bill Clinton, he had those puffy eyes all the time. He had bad allergies, those bags under his eyes, okay? And then as you saw that first girl that Dr. Underwood showed with the, you know, totally normal appearance, then right before she turned the bad corner, she started to get puffy eyes. Did you see that on the slide? Allergies, inflammation, the immune system, the GI tract was all going haywire at that point. By that time, you can't get things into your body that you're allergic to unless you have a leaky gut. They just don't get in. That just doesn't happen. Okay, so diagnosis and treatment meaning having identified as best we can what there is, what do we have to offer to help it to get better, fix it, do something, all right? What about parental? And there's the third dash down there, it should say parental. That first T should be an R, sorry about that.